I've got about 20 minutes before I leave for clinic. I put together some before and afters. We can talk through. These are some of my patients I have treated over the years. I am Janelle. I'm a cosmetic nurse practitioner. I've been injecting Botox and fillers, doing skin treatments like lasers, microneedling since 2013. So 11 years. I specialize in facial aesthetics, non-surgical treatments. Natural aesthetic is my goal, and I treat all skin types and tones. I treat a lot of women and men of color. So we did this yesterday. I put together some different before and afters of my patients yesterday. We went through it, and we can talk through some of these patients today and what we've done. So this patient came to me. She wanted to get nose filler. She did not like the bump along her nose. She did not want to go through surgery. She didn't want to do the downtime. Her family also was like, no, just do this thing. So we took her nose from here, where we had more of a bump and it was more downturned, to straight. We did her nose over 3 sessions, about 6 to 8 weeks apart in between each session. With filler along the nose, we can lift the tip of the nose. We can straighten a bump so it looks straight from the profile. From the front, we can create a highlight or contour down the center so that it looks like more defined. There's no downtime with this. You can see the results immediately as we're doing it. You can get a little bit of swelling, maybe some bruising, so that's something you need to plan for. Other things to keep in mind are, if you wear glasses, goggles, anything really tight along the areas that we inject, we just need to be careful. Avoid doing that because it's filler. It takes 6 to 8 weeks to fully settle. If you are pressing on it, you can indent it. So let me see if there's questions. Someone said Botox to slim down the nose. You can use Botox to help along the nostrils to help prevent nasal flaring. So that right there where the nostrils flare, you can use Botox here to help prevent the nose from curling down when you smile. So that is not the results on that are not as profound as when we do filler. So this is more of like a filler result. And you can see I've treated a lot of noses like this. I've treated, so many different types of noses. Some people will have more of a bump. Some people are just trying, they like their nose. I see a lot of women and men of color, and they're like, I like my nose. I like my ethnic features. I'm just trying to create that definition or that highlight down the center that I will do with my makeup to make it look more contoured. So that is something we did there. Okay, next patient here, gorgeous. She came in for facial balancing. We specialize in this at our office. This is where we are analyzing your entire face, assessing your full face, looking at your features, talking about your goals, looking at how you're aging, considering your cultural preferences, your ideals of beauty. She wanted to enhance her side profile. So for her, we did a little bit of filler along the cheeks laterally to create this highlight on the cheeks so it looks pulled up and lifted. And then some into her chin to elongate the jawline and balance, the naturally full cheeks, full nose, full lips. So we did this over 1 session. This is immediately before and after. Again, she's going to bruise, she's going to swell. It's going to look more dramatic in the beginning, and then it will come down. Wait 6 to 8 weeks before you add any filler to the same area. So this is just showing on a black girl doing chin filler. I have done this on myself. I've done cheek filler, smile lines, temples, lower face shadows, all the things. This is another patient, a Latina girl, that also was coming for facial balancing, and we did some filler into the lower face, into the chin, to help balance. You see her naturally full cheeks, full lips, full mid-face, and then now when we put filler here, it's elongating the jawline. People tell me, oh, it looks like you got rid of my double chin. They say that all the time. We're not reducing fat. We're not taking fat away, but when we elongate this jawline, it does help to camouflage some of the fullness. When we do chin filler, I want patients to know it's not just right here that we're doing it. We're also treating into the shadows. We're connecting it to the jawline. Usually when we're doing the lower face, I consider this your lower face complex, not just your chin. It's going to be around 2 to 3 syringes, maybe more depending on how far back the chin sits. Syringes in my clinic are $950 each. So 1900 to 91820 2850 is what most people will land on for their chin. Maintenance on this is usually coming back around 1 to 2 years. And when they come back, it's not like they're back to square one, like they've never done anything, but it's not like this. And so they say, oh, it's not all the way gone, but maybe I should do a little bit because I see it's, it's not the same effect as it was. So yeah, you can see a really beautiful result there. Let me look at some comments. Someone said, what do I recommend for smile lines? I did all right 2 years ago. Hey. Okay. So smile lines goal. And a lot of patients will come in and they notice these lines are getting deeper as we get older. Smile lines, the goal is to soften, not to take them all the way away. When people try to get the lines all the way gone and try to look like a filter where there's no line, it's going to look weird. So I tell patients, soften. We're going to put some support underneath so they don't collapse in as much. We're still going to have lines. You're still going to move your face. You're still going to talk. You're going to do all this. So you're still going to have smile lines. Do it over a couple sessions. Sam, you said we did eyes a couple years ago. Like we know I probably did this over 2 sessions. Everybody I see, I say, don't rush this. Like do it. Let it settle. We reassess. We can always add more over time. And that way it looks the most natural. It's true to you. I'm not having to over inject and then dissolve. So that's the goal. Smile lines, when we soften here, usually about 1.5 to 2 syringes. But we also want to look at what is causing the smile lines to have this depth. A lot of times it's because we're losing volume starting from up top. So we have different fat pads in our face. As we get older, we lose bone, we lose fat. So these fat pads start separating. So we'll get a line from here through our cheek. We'll get this one, the corners of the mouth. This fat pad keeps dipping. It'll create the jowls. So if you have volume loss in through the mid face, which is pretty likely it happens, you can see early signs of it in our late 20s into our early 30s. As we get older, these same areas, they will continue to droop and lose volume and separate in the fat pads. So if you have volume loss here, I might talk to you about putting a little filler here to create this highlight where the cheeks will look lifted, and then it's not actually like pulling your face back where you're not going to have a line if you do cheek filler. But when you have this highlight through here, this line is not showing as shadowed. It doesn't look as distracting. So a lot of times I start hear people like, oh my gosh, it fixed the line already. Or my lines don't look as deep. That's my goal. It's because the cheeks have this highlight where it looks lifted, not pulling you back like a surgery, but it's an illusion. And then we'll use some right by the sides of the nose. We lose bone here as we get older. We lose volume here. This will get sunken. So putting a little filler here helps to kind of pop out. Usually this is where the deepest part of the line is, so it helps pop that out. Okay, this patient, beautiful. We did under eye filler on her. And so you can see her complaint was feeling like she had volume loss, dark circles. When it comes to volume loss under the eyes, late 20s, early 30s, we can start seeing it. It's going to continue to happen over time. Remember, I said we have fat pad, they separate, they start sinking. So people will have this line underneath the eyes. I let patients know that's what I'm doing. I'm using filler into that line and laterally to help lift up the skin and camouflage the fat pad. We all have fat pads underneath our eyes. So on this patient, you see, it just looks like slightly shown. Some people's fat pads show more than others. If you have a fat pad that shows out a lot, like it looks like an eye bag, I let patients know I can't take that away. I can camouflage it. Next round I do live, I'll show somebody with like a fuller fat pad or what a lot of people describe as an eye bag. We can camouflage it some. We can't take it away. To get it all the way gone or to tighten it, that's surgery. If you're open to surgery, do a consult, do that. Sometimes even after surgery, my patients have gone and got the fat pad removed or tightened. They still have volume loss. So we'll go underneath and we will camouflage like the volume loss. You're not a good candidate for under eye filler if you get puffy under your eyes. So if you swell a lot, if you have really bad allergies, if you eat salty food, spicy food, if you cry a lot, you eat those things and you wake up and your eyes are puffy, don't get filler under the eyes because filler binds water. Anyone that naturally swells or gets puffy, they're going to get worse swelling with filler. So we want to make sure whoever we're treating that they're good candidates for the procedures. If not, you're not going to have a good outcome. If you're not a candidate for filler, there's other alternatives we can do, like the all-natural filler alternative where we draw your blood, we spin it down, we heat it. It's all natural, and it's going to make collagen over time. So that's something you can consider. So back to under eyes, you can see immediately before and after, she feels like she looks brighter because that skin is lifted. Filler won't take away the color of our skin. So you can see she has like that natural darkness underneath. People always tell me like, it looks brighter. It's going to look brighter because it's not sunken in, but I'm not actually changing the color of your skin. We can't do that. We're born that way. It is what it is. I will tell patients, if the color bothers you, I don't know anything to change the color. If you know something, tell me. That's the one thing I will do is put on concealer in the day besides my sunscreen, because, and I'm not that good at it. It looks all messy. Concealer underneath my eyes because even though I'm not sunken, the color makes it look darker. Patients will tell me after filler, they're like, oh my gosh, when I use concealer, my concealer actually works. It works because now they're not trying to camouflage the depth, the hollow, the shadow. So this is under eye filler, and I think this was after her second. I can't remember if it was after her first or second session. Looks super natural, still looks like her. That's always the goal. My goal in our clinic, this is what we do. We want it to look like you. We want it to look fresh. It doesn't need to look like you've had filler done. We talked about this patient already doing into her chin. Yesterday I had guys I did 2 lives yesterday and they kept saying, do you do men? Yes, we treat men. Here is one of our patients. We have done a lot of stuff I've been treating him for a few years. We started out with the under eyes and Botox. So came in for feeling like he looks tired, trying to camouflage those little fat pads. Remember those fat pads we all have? Some people's just stick out more than others. So we did this over a couple sessions. He still has a fat pad. It's just not as apparent. That's the goal. We've also done skin treatment like laser. We have done Botox into the fine lines so you can see where those lines are a little bit more etched and they're smoother over time. Look at him. You wouldn't think, oh my gosh, this dude is done filler. Like, no, it doesn't look like that. We've also done jawline, chin filler, all these things. Looks super natural. He's great on his maintenance and he just looks fresh. And we've been together multiple years. He looks younger this day than when we started. And he's very happy with all his things. This, and I will go through comments after this. Do I have patients before and after results and they're 50 plus? I have every age, I have every race, I have everything. So on my social medias, you can find them. I treat a lot of TikTokers and some with huge followings that are 50 plus that show and tell their stories. And on our website, I just pulled these really quick. I was like, I have 30 minutes before clinic. I'm going to try to go live today and I went through some yesterday. I can show all the ages, every race, everybody, every face, because that's what I do. I really treat, I see everyone in our office. It is not just it's not everyone looking the same. Okay, this patient, beautiful, and she came in also for facial balancing. I have a front picture of her somewhere, but we did under eyes and the lower face into the chin to help balance naturally fuller cheeks, fuller lips, bringing that jawline forward. Again, looks super natural. Looks like she was born this way. That's my goal. Not trying to make anything look overdone, overfilled. Okay, I'm going to go through some questions. Okay, before we get out. Is that PRP, that natural filler? It's like PRP, but an extra step. The heating component of it is going to help make the growth factors stay longer in your skin. So we're talking about the all-natural filler alternative. We draw your blood, we spin it down. There's nothing in the tube but your blood. We spin it, we heat it. It's all made from you. You can watch the whole process. We don't add anything to it. It's really cool. Your body, it's going to be getting the growth factors, and when we spin it and we heat it, and we're putting it into areas where we're noticing volume loss and we want to stimulate collagen, your body is going to stimulate new collagen in those areas that we inject over time. Limitations with this: a younger, healthier person is going to have a better outcome than if I have a 75-year-old that's a smoker and that has uncontrolled diabetes. Their blood is not going to be that great and not going to give us a great outcome. So that's something to keep in mind. I really like doing it under the eyes, smile lines, corners of the mouth. Those are like into these shadow areas. Patients really like those areas. Into the chin as well is nice. And it's just all natural. It's I know filler gets a bad rep a lot of times because we see the work that looks ridiculous and everybody thinks that's what filler looks like. You can tell filler doesn't have to look crazy. All these people look natural. That's the goal. But if you don't want filler, that's a great filler alternative, and it's going to stimulate new collagen in the areas. A lot of patients will do both. They'll start with the filler alternative, and then they'll do filler if they feel like they need an extra boost. I've done them all on myself. I like them. Okay, any device on deep wrinkles for over age 50, they told you Botox won't work. So if you come in and you already have I'm saying, don't frown, relax your face, and your frown lines are like this at rest, and they just look mad. Botox won't take away this if it's already super deep set in and you're smiling and it's deep set in. Botox will prevent it from getting worse. So Botox is going to relax the muscles from making the frown motion so they don't frown. And like if you continue to frown and use those muscles, the lines are going to get deeper, deeper, and deeper etched. So Botox will relax it from happening. It's not going to smooth it out to be like, oh my gosh, you never had any lines there. It's just because those muscles have been used over years and years, and so they're deeply set. So I would Botox it to prevent it from getting worse. You can consider doing the all-natural filler alternative into the lines, maybe a small bit of filler to soften them, and then using your retinoid, using your sunscreen. Those are things that you can do at home that will help with new collagen and just fine lines, pores. Okay, somebody said they have hollow under eyes. Hollow under eyes, you can do filler and or the PRP Easy Gel filler alternative. Someone said their nose droops. What can you do when they smile? So if you smile and the nose goes downwards, sometimes I'll put Botox here, and that'll prevent the nose from drooping. It lasts a few months, like 2 to 3 months. If you want more of a profound result, filler. So this is somebody, even when she doesn't smile, she's like, my nose droops down, but I know what you're talking about. Some people, the tip of their nose kind of moves. You can try Botox. If you want it like more lifted or straighter, even at rest, filler is going to give you the better alternative. I don't know the cost for these things off the top of my head. They're on my website, or if you text my team, they can do it. I just don't want to tell you guys the wrong pricing. I know our filler is $9.50 a syringe. I just don't know the cost of the under eye PRP off the top of my head. We do it in 2 sessions, and then it's like a cheaper price if you want to add on a third. You can do it on your neck as well. Yes. Smile lines, you can soften with the PRP, all natural filler alternative, or you can do a collagen stimulator like a Sculptra or Radiesse, or you can do filler. The goal is to soften, not have them all the way gone. If we have them all the way gone, it's going to look weird. I don't have a timer, and I need to... Okay, I have a few more minutes before I head out. Recommendations for filler in the cheeks: don't overdo it. Make sure we're using the appropriate product on the appropriate patient. So for the cheeks, remember I was telling you guys earlier, we have our fat pads start sinking and separating as we get older. Starts from the under eye, get through here. So a lot of people will have this line on their cheeks. I will go into this line and I will soften it, and then I'll do a little bit lateral so that it looks like the cheek is like a natural highlight, like it looks like it's pulled back. That's the illusion I'm trying to create. I don't want the cheek super puffed out when you smile. I don't want it to look overfilled, overdone. Do this stuff in stages. Don't rush it. Go to somebody that can show you their work and that you like their work and their aesthetic and their face. If their face looks overdone to you, that might be their aesthetic style, and they will probably want to make you look the same. So be mindful of that. Yes, we have this line since a kid. It will get deeper as we get older. Yes, I see it on my little kids too. It's just where our fat pads are separating. As we get older, we'll get deeper, deeper, deeper. Walk outside today, look at somebody walking on the street. The older they are, the deeper this line tends to be. And even I'll see it more so in people that have like thinner faces. It's like even more, but even in people with fat in their faces, like full cheeks, we will have it as well. So it's using the right product to soften that line and create that highlight, not overdoing it. And then, hi, how are you? Great seeing you. What are risks with filler? Okay, filler risk, safety that you want to be mindful of when you're doing cosmetic injectables with filler. We want to make sure that we don't block off blood flow. We've got blood vessels all over our face, all over our body. When I'm injecting, I'm making sure that we're not blocking off blood flow. That's what I'm trying to make sure of. What we're looking for is that your skin color is normal, not paler than normal. If it's paler than normal, blood can't get to the area. Blood is not moving to the area. You shouldn't have any extreme pain. If you're having pain, blood is not getting to the area. You shouldn't have any vision issues. If you're having vision issues, blood is not getting to the area. If you had any of these things, stop, dissolve the filler. This is super rare. I tell my patients, I've been injecting for 11 years. This is what I specialize in. This is what I do. I've never had to dissolve anybody for any emergent reason, any part of their face, any filler. So it's really rare. However, these things can happen. These are medical procedures. This is why you want to be going somewhere where the person has the stuff to dissolve in case of an emergency, knows what to do. I'm telling you this because I've had patients come to me to dissolve stuff just for like, oh, it didn't look good. They went somewhere and, they have a bump. I say, hey, why didn't you talk to your practitioner? They can dissolve it for you, probably for free. I'm going to charge you. And they say, oh, I did ask them to dissolve it, and they didn't have any dissolver in their office. In my mind, I'm like, that's not safe at all. If there was an emergency, that person can't intervene and handle that emergency. So for my patients, people fly in every single day. I'm in clinic. When you fly in, I ask that you stay in town for the day. If there was this emergency, you would have pain, you would have something weird, like vision issues, the skin color is pale, we would know and we would dissolve it before you leave. Again, I've never had to do that for anybody, any part of their face, any filler. I've been doing it 11 years, but we just want to be mindful of these rare risks. Also, we're not trying to over-inject the areas. This is what I'll tell people. Let me see you back in 6 to 8 weeks. I can do more later. The more I put, though, in this one day, in this one session, like the higher the risk for blocking off blood flow. So those are things. Let me see if I hit any. Is smile line filler better to do with PRP? Is there less chance of migration? They're both great options. You can do PRP. It's going to take a little bit longer to see the results because it's going to depend on your body stimulating new collagen in the area over time. Filler migration, honestly, I see this all the time. If my filler migrated, dude, you probably shouldn't have had filler in that spot, or you were doing too much, or just like injector didn't do that great. But usually when people are talking about filler migration, I see it talking about their lips or their under eyes. So for the lips, a lot of times patients are just like, I want more, 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 more. Stop. Like if you keep going more, it's not, just because you like keep plumping, it doesn't mean your lips are going to get bigger in the pink part. There's not space in the pink part. It's going to go above. That is when people are referring to migration. I refer to this as overfilled. We shouldn't have done that in the first place. Like, don't do that. So understand there's limitations with cosmetic injectables. Don't try to push it. If you have naturally thin lips, you're not going to get fuller lips than me ever. Even if we just keep plumping it, we can. It'll look puffy up here, and that's not what you're trying to go for. So we want it to look natural. Don't rush it. Filler's not going to be migrating here if you're not messing with it. If you're not overfilling it, you're okay. Recommendations. I don't know what I did. Recommendations for filler in the cheeks. I think we went over that one. Yes, do it. Don't. Make sure we're looking at the natural highlight of the cheek. We're not trying to create something weird that we don't have. Will cheek filler migrate? Again, migrate. It's not slipping and sliding around your face. It is, if it's overfilled, it just looks bad. Filler, I have so much filler in my face, guys. Like I do. And it's not moving from here and then coming down. What you want to do to minimize the risk of filler migrating is like during the healing time, don't press on it. Don't touch it. Don't lay on your face. That can flatten it. And then don't overfill an area. If you're overfilling an area, that's when people will say migration. Really, it's just the filler can't fit in that area, so it's puffy above the border, or it's too puffy under their eyes. I'm going to do this last question. I'm going to get ready to go. And, hollow under eyes. I'm going to post this because we talked a lot about under eyes. We went through that one. We went through this one. We talked about filler. We talked about Easy Gel, PRP, where we draw your blood, all natural filler alternative for under eyes. Go slow. Don't rush it. Okay, so I saw a question. It was on Botox for masseters. So Botox here for TMJ symptoms like clenching, headaches, teeth grinding, jaw pain. We can relax this muscle. This is a chewing muscle. Bite down. This muscle will flex, and this muscle will flex. Our masseters and our temporalis, both are chewing muscles. When we are overusing them, or we're clenching or grinding at night, people will feel pain here. People will have broken teeth. We can use Botox to relax the muscle from flexing so forcefully. This takes a few days to kick in. 2 weeks is the full effect. Effects last about 3 to 4 months, so people will do this a few times a year. It will help to slim the face if your face is wide from overuse of this muscle. So if a lot of times people will notice when they have their TMJ symptoms, they're like, my face is getting more square. It looks bigger from the sides. Next time I do a live, I'll post one of these too, and we can talk through like the slimming effect. So when this muscle is not flexing all the time, it gets to relax. It will help to slim out the face if your face is wide from this muscle. Now, if your face is just wide because naturally your face is fuller, I don't expect you just put Botox, it's going to snatch you. It's going to happen over time if your face is wide from this muscle being overused. Expect to see some slimming like 2 months out, and then with your subsequent treatment as that muscle is in that relaxed state. Best for under eye, do not put Juvederm under your eyes. It binds a lot of water. Filler binds water. We have a bunch of different fillers that are FDA approved on the US market. Some have a higher affinity to bind water than others. So that means some draw more water in than others. Juvederm is extra juicy, and it's going to make your eyes get really puffy. So don't do that. Do numbing cream and filler. Okay, I don't do numbing cream on my patients when they come in, and it's not ever to be mean. We have a bunch of pain like management techniques in our office, but numbing cream in my hands, when I see the patients, it swells them up. Like they'll put it on their lips, like, oh, this is how my lips, because they're swollen. I can't see what I need to see, or they get really red on their skin. I'm looking for these like fine shadows on the face, fine lines. If you are puffy or swollen from numbing cream, it's harder for me to inject, and I need to get you an awesome result. So I don't do numbing. We give you ice. I transfer the product to like the tiniest needles. I pay extra money for smaller needles than what the companies give me in the box with the filler. Transfer it into these small needles, and I have one of my medical assistants. I pay money to have an extra person there to tap your shoulder to distract you from the pokes. Patients tell me all the time, oh my gosh, this is really not that bad. Look at my page. See these patients just sitting there in the chair having full conversations with me as we're injecting, and they're like just talking. They're not screaming in pain. They're just chilling out. You're going to feel a poke. It should not be any extreme pain, but it's quick. And then they tell me if they've had numbing before somewhere else, and then they came to me, they're like, this feels the same as getting like even with numbing, it still hurts. And this is the same. Like this is less because my needles are smaller. Okay. And then, so thanks, Sam. She said her needles are small. Thank you. Barely felt it. I appreciate you. All right. I have to go to see patients. I appreciate you. I'm going to try to do more of these, just talking through patient before and after, showing my patients. And they're so awesome. Thank you guys for sharing your stories and your pictures and just helping to educate. I'm always trying to show more diversity in aesthetics. I'm trying to show more people of color because I don't think this gets highlighted in our industry. Like when you look at the campaigns, for the longest time, it was only a certain person, and I'm like, no, we need to show all the faces. Everyone deserves to feel safe, seen, beautiful, heard in this space, and so I'm always trying to highlight that. Thank you guys for hopping on. I will try to be on later. Appreciate you. Have a good one.